Hi, I'm Dr. Shay Corbin with MedSpine, and we are here talking about wrist exercises today. There's a bunch of different wrist injuries, real common ones, carpal tunnel. When you fall on an outstretched hand, you can sprain or jam your wrist pretty bad. So we're going to talk about stretching and a few of the exercises that come along with the wrist. So Brittany, let's show them the wrist stretches. So first we're going to do some wrist flexion stretches. The flexors are the bigger muscles in your body, and there's two ways to stretch that. First we do the up, and so what you do is you take that hand and then you straighten that arm out like that and you pull with the other arm, and you'll feel that stretching all along this area right through here. And then from there, you'll actually flip that over and again, straighten that elbow out, and you can really feel that stretching all up in here. Those are fantastic for carpal tunnel stretches. You want to open that carpal tunnel up right here. You don't want to close it down a whole lot. So you want to stretch here and here for carpal tunnel, and that will really help that. And just any wrist injuries as well. And then people get tennis elbow a lot, lateral epicondylitis. So we're going to do that other stretch. You can really feel on that back side of the wrist and this epicondyle, these extensor muscles. You grab those fingertips for me, Brittany, turn to the side just slightly, and then you pull, and you really bend that thing there and just really pull with your hand, and you'll feel that stretching all the way up to there in most instances. Again, stretches are supposed to be non-painful. If you're having any really severe discomfort, stop, obviously, back off a little bit, lighten them up. A light stretch is much better than a more intense stretch. I'd rather you stretch light multiple times frequently than a real intense stretch and be so sore you can't stretch for 2 or 3 days. You're not going to get as much out of that. So those are the wrist stretches for us. And then now we're going to do a little rubber band exercise. So the rubber band exercise is literally a rubber band. Most of us have them around. That's why they're useful. And so what we do is we just put them on our fingers here, and then you just open it up, and then you slowly let it go back down. You can double them up, and or maybe you can double them up. You can double it up and make it much harder. And so you just do that extension, and that really strengthens this area back here. Again, a lot of people that type, mouse click, and all that stuff, we end up with these carpal tunnel, lateral epicondyle issues. The rubber band is a really great way to stretch those. So then we're going to talk about wrist flexion and extension. Again, another great exercise, probably the most well-researched exercise for lateral epicondylitis or tennis elbow is flexion extension. The ratio is super important. Can you sit and show the guys? We're going to start with wrist flexion with the 5-pound. So that ratio should be 80% of each other. So I'll make the math easy. If we have a 5-pound weight, 80% of that is going to be 4 pounds. If we have a 10-pound weight, 80% of that is going to be 8 pounds. And so that's an easy way to think about it when you're doing that. So these muscles are much bigger than these muscles back here. So the heavier weight goes here, and we do flexion. So let's go ahead and get that knee down, bend that elbow here. We want to rest it. We want to keep this elbow bent and close to the body, and we let that come down, and then we come right back up and come down, and we control that motion. Go ahead and do 10 of those for me. We control that motion up and down, up and down. We don't just let it drop down and flail around. And so as we do that, you'll feel all those big flexor muscles really getting in there. Again, that ratio is critical. 80% of each other. So the bigger, heavier weight is 5 pounds, the lighter weight is 4 pounds, and that's what we're going to do now. So if you want to go ahead and pause and do the rest of your flexion exercises, you can do those now. You want to get at least 20 repetitions, no more than 2 sets, no more than twice a week for lateral epicondylitis. So now we're going to move on to extension. This is the one that often hurts people when they do it. And so pain, again, is very important. The closer you hold it into your body and bend over a little bit more, that angle right here is really important. If you have that big angle, you take some of the stress off of that. If you just straighten that arm out and start doing it, when you grab that coffee pot and pour it, it's killing you. Or you grab the milk out with an outstretched arm, it really hurts. If you keep everything close into you, it hurts it less. So let's go ahead and do extensions, and that's gonna work these muscles right up here. And again, you control that motion up, you control that motion down. And again, the lateral epicondyle is a tendon thing. So it's tendon fraying either into the insertion of the bone or into the myotendinous junction. And so less is more. We want to work it out. We want to bring blood to the area, but we don't want to overwork it. You can easily overwork it, and you'll know because it's not going to feel good. That's good there. And so I want to switch to ice cupping for this before we do our paper crunch. Ice cupping is a great tool that we use in sports all the time. What is ice cupping? It is a cup of ice. So you get those little paper Dixie cups from Albertsons or wherever that are about this tall. You fill them 3/4 of the way full of water, and you freeze them, and they'll be almost full. You hold the bottom of the cup and you peel the paper back a little bit and expose the ice, and then you can flip it upside down and you put that ice right on that area. Works really good on that elbow right here, a wrist, an AC joint, that acromioclavicular joint in the shoulder, knees. It works fantastic for a lot of those places. These shallow joints, ice cupping is absolutely one of the best therapies that you can do. This may hurt. It may all of a sudden start aching. Just pull the ice off for, a few seconds or 60 seconds or so, and then go right back to it. 10 minutes is really all you need on an ice cup in any different body part. Again, multiple times a day is always best. So ice cup, paper Dixie cup or something, 3/4 full with water, freeze it. You can freeze a bunch of them so you always have them. Peel that paper back a little bit. That way you can hold on to the bottom of the paper and it's not cold on your hands, and then you can do your ice cup for 10 good minutes. So paper crunch is something that we use for all kinds of things, and it's all about manipulating the hand and wrist. And so it literally is crunching a piece of paper on a desk. We're going to use this little piece of paper, and you just want to kind of crumple it all up until all of it is underneath your hand. Go ahead and do that for me, Brittany. You see how she's got to reach and move and do all kinds of different little places. And then once you get it in there and you squeeze it tight, you can unsqueeze it, lay it flat, and do it again. And that way you can reuse that paper over and over. So again, flexion extension, 20 repetitions, 2 sets, twice a week, ice cupping 10 minutes, rubber bands, that's going to be another high rep item, 20 to 30 repetitions. And then the wrist stretches. Open that stretch up for the carpal tunnel, and then for this epicondyle, grab the tips of those fingers and pull down, and you'll really feel that. And that's all we have for the wrist.